for one thing, but not for what I have to speak on, actually. And we're coming out. Good afternoon. My little people. Well, thank you all so much for being here this afternoon. I am joined by Dr. Jennifer Avegno, as you know, who is our director of the New Orleans Health Department, Dr. Emily Nichols, who serves as our director of EMS, Colonel Terry Ebert, who serves as my director of public safety and homeland security for the city, and of course Colin Arnold, who serves as our director of homeland security and emergency preparedness. Very sobering day. And over the past couple of days, it's been really sobering and shocking, quite frankly, and alarming as we look at the average daily cases of COVID that are specifically the Delta variant is alive and very much well in the city of New Orleans. And it is and has caused us to not only hone in on it, but come before the public and strongly, putting in place an indoor mask advisory. There is no way around that. This advisory speaks to the needs on the ground that we're seeing more cases. Average daily cases went from 11.43 on July 5th to 104 as of yesterday, July 20th. That's 9-fold of an increase in just 2 weeks. It's more aggressive, it's deadlier, and it is in our community. Statewide, hospitalizations have more than doubled in that same time frame, and the rate of positivity is over 5%. And that is the alarm. Nearly all of these cases, as I mentioned, are from the Delta variant. And I have to repeat, which is more transmissible and potentially more deadly to our people. Now, collectively, we have lost 808 New Orleanians since the start of this pandemic. 808 lives that are gone. The rapid spread, again, of this Delta variant and the dramatic spike in cases, we have to move towards an indoor mask advisory, putting more responsibility on residents in our community that have yet to be vaccinated. Now, currently, our guidelines require those who are not vaccinated to put that mask on. But what we've also found is that that isn't happening as it relates to those who are walking around unvaccinated. Those who have gotten their vaccines, one, thank you so much for doing the right thing. Thank you so much for not looking at self, but looking at our entire population of the city of New Orleans and wanting to lean in to do the right thing, again, not only for yourselves, but for your neighbors, for your families, and of course for your friends, and for all of us who call New Orleans home. We know that masking works. We've seen this movie over and over again. And because we've seen this movie over and over again, what really gets me so riled up is the fact that cases that come, and with the rapid pace that they're coming our way, in weeks' time, they end up resulting in deaths in our community. And we have the power to prevent that from happening. Again, we know that masking up works. While I have in the past gone maskless, I'm masking up, going into wherever I go with that mask on, even in my office. This is the most immediate thing, most tangible thing that we can do to slow the spread. And if we do what is right, then we will stay on the path to seeing the benefits of us making the right choices. And those benefits have been the city opening back up, our tourist economy moving in the right direction, our businesses, again, moving in the right direction. But we want to continue to move in that right direction, not pull back at any level, especially as our kids are preparing to go back to school, especially as we've done all the hard work necessary to make our city ready for festival season coming in the fall. We've done the right things, and we've proven to be leaders not only in the state, but leaders in the United States of America. So I'm calling on all of our residents who have not been vaccinated, get vaccinated. And I'm really encouraged, as we have been in my administration, my entire team has been messaging this out every single day this week. But as a response to that, what I believe is a response to that, and I've been kind of lurking in the background of many of our vaccination sites around the city. And I'm seeing lines, which is a good thing. And it seems like there's been an uptick over the past 2 days than we saw over the past week or so. So with that, I'm encouraged. But the advisory is something that we have to put in place, trying to take a different approach to reach our people to do the right thing. So don't let us go back. This city cannot afford for that to happen. And so with that, I'm going to ask Dr. Jennifer Avegno to come after and just to share her insights with you on the ground. You'll hear also from Dr. Nichols, and then you'll hear, closing us out, Colonel Ebert. And of course, I'll be around. Thank you.
Thank you, Mayor. You know, as the Mayor said, there is some good news. We continue to be the most vaccinated parish in the state of Louisiana. Our vaccination rates are at or above the national average. And that's something to be grateful for, to thank our residents for. But the problem is that the burden of the Delta variant among our unvaccinated residents and neighbors and those that come to New Orleans is such that it is putting all of us at risk. We're here today because we are in the midst of a spike, and transmission is increasing at a rate we have not seen since last spring. In the last 2 weeks, as the Mayor said, daily cases, the average, have increased 9-fold. Today, as you all probably heard, the state announced its third highest case count since the beginning of the pandemic, since March 2020. Locally, our percent positivity that's reported by LDH has gone from 1.6%, where we were incredibly low for months, to 6.5% in 2 weeks. This is not because of decreased testing. This is because more people are sick and getting tested. The really concerning thing is this. COVID hospitalizations statewide are increasing significantly. Today reported 913 hospitalizations. On July 1st, it was 260. Everybody can do the math and know how fast that is. Dr. Nichols is going to talk about our hospital capacity in a little bit, but I can tell you we are already experiencing a serious healthcare worker shortage. We do not have the capacity to absorb the rapid rise of increasing cases we're seeing statewide. That's our adult and our pediatric hospitals. And I'll just personally, as you know, I'm still in the ER a little bit, hadn't seen a COVID patient in weeks come to the emergency department. I saw 6 in one day, just me. Plenty other doctors seeing patients over the weekend. Furthermore, as many of you have experienced personally, we're starting to see camps and daycares as well as other businesses once again close or limit their operations because of the number of staff who are out with COVID or on quarantine. The overwhelming majority of cases, hospitalizations, and deaths continue to be among people who are unvaccinated. In Louisiana, 97% of the severe COVID cases, so a hospitalization or a death, are among unvaccinated individuals. And as the Mayor said, almost all of the virus circulating now is the Delta variant, which indeed is significantly more contagious and more serious. But because the burden is so great, there is so much virus circulating so widely in our community, we are starting to see those breakthrough cases. We knew they would come. We anticipated they would come. They're here. The more virus there is, the more of them, and the more of them are going to be severe. Of the severe breakthrough cases, it's affecting the same people that were disproportionately affected in the beginning, our elderly and those with high-risk conditions. Those people who probably have done everything right, stayed inside, didn't go visit their grandchildren, got their vaccination when they could, once again are at elevated risk because of the pool of unvaccinated people who continue to spread the virus. We only need to look at other vaccine-preventable diseases to parallel this. This is not something all that new. Nearly everyone in the world is vaccinated, or at least in the U.S., against polio and measles. Measles is still around, but it has nowhere to spread because everyone is protected against it, or 95% of people are. So it's nearly eradicated. When people refuse vaccines, a disease has ample room to spread, to mutate, to threaten even those who are vaccinated. So as people continue to refuse to take the life-saving COVID vaccine, you are definitely taking a risk with your own life and health, no question about it. But now you're putting the rest of us in jeopardy. Again, our vaccinated, elderly, immunocompromised, medically fragile residents still face a higher risk even if they're vaccinated. They'll be much better protected. But the more disease out there, the more likely it's going to come for them. And again, let's not forget our children under 12 who cannot be vaccinated yet. They are completely unprotected if adults who could take the vaccine continue to spread the virus. So again, as the mayor said, all of this data is the same data we've been following since March, and we're going to continue to follow it. And it's not just the cases, it's the hospitalizations, it's the capacity. We don't even know what's happening with deaths yet because it's too early because this is happening so fast. So that's why we're announcing an indoor mask advisory that strongly recommends anyone, vaccinated or not, wear a mask when indoors. You've seen the WHO put this advisory. You've seen the American Academy of Pediatrics, as recently as yesterday, say this should be the case for schools. So when you are indoors with anyone who's not a member of your immediate household or in any setting you might be, please wear a mask. We will continue to monitor transmission, hospitalization data very closely as we always have so we can see how the mitigation is working. When we were here a year ago talking about a surge, masks and social distancing were our only tools against COVID. But because of the enormous worldwide effort to develop safe and effective vaccines 1 year later, COVID is a preventable disease, just like measles, just like mumps, just like all those diseases that we don't get anymore. And yet, we have to now continue to rely on masks because some in our community continue to refuse to get vaccinated. That is not the news that I wanted to share today. We are doing so well locally in the city of New Orleans in terms of vaccinations. It's not even. We have several neighborhoods, several areas that are not close to that 70%, and they are very much at risk. And so we need to implore everybody to get the vaccine. So please, if you're vaccinated, please tell your story to a family member, a neighbor, a colleague, that they are safe, effective, and life-saving. You can find a vaccine site near you at ready.nola.gov. I'm so glad, Mayor, you've been secret shopping. Yeah. So you know that we are there in the neighborhoods, in communities, at the hospitals, at Walgreens, at CVS, anywhere you can think of, you can get a vaccine. If we do this wonderful fall that we've got planned, our festival, our football, everything we want to do, it's going to proceed as planned. And that's what we all want. And that's what we're all planning for. And we know that those organizers want it, our residents want it, everybody wants it, and it's very much within our grasp. We just have to keep doing this. So mask up, sleeves up, please let's come together again and keep everyone safe.
Thank you, Dr. Avegno. Dr. Nichols?
Thank you, Mayor. Thank you, Dr. Avegno. This really could not be a more critical point in time. While our city welcomes persons from around the country and around the state of Louisiana, we not only welcome them as tourists, but also as patients. The clinicians here in the city of New Orleans are frequently receiving very sick individuals from the rest of Louisiana, because we have here the specialties able to care for those most critical individuals. As the rest of the state and the rest of our city and our country gets COVID, those patients come to New Orleans. Our beds are filling up. Our providers are working long, hard hours, and they've been doing that before COVID, and we know they've been doing that through COVID. The effect on the hospital affects our first responders. We know that there are workforce struggles throughout the nation and also in EMS. All of that trickles to the health of our community. The health of our hospitals affects the health of the community. It is so important that we do what we can to help each other, to get vaccinated, to make sure that it is not when your loved one is on their deathbed that you decide whether or not you believe the vaccine. That is not the moment in time. That is not a gamble that you want to take. We are seeing it every day. People are still dying from this, young, old, in between. COVID is so present and so real, and our workforce is really doing the best that they can, but you have to do your part too, so that we can all come through this. Also recognize that you can contact people other than 911 to evaluate your needs. If there's a healthcare line at your hospital system, utilize that. Utilize them to figure out where to go to get a vaccine, or whether or not you should go to the hospital, or whether or not you should call 911. These little acts make such a difference as we move forward. We are really at a crucial moment when everyone has to do their part. Thanks.
Thank you, Doctor. Thank you so much. Colonel?
Thank you, Mayor. I just have got a couple of things that I want to leave in everybody's mind. That as the elder statesman around here, I can go back a long time. And I learned very early in my life, in my previous occupation, that you cannot order anybody into the valley of the shadow of death. You can only ask them to follow you. Everybody you've heard from the mayor on down is asking you to take the lead, do the responsible thing, get your family vaccinated, get yourself vaccinated, and be a leader rather than a follower. The choice is yours. This is a great nation. We can do better. And I'm asking all of you to take that to heart and ensure that in your realm of influence, you're the leader. You're asking people to follow you. You're not ordering them to do anything. Thank you very much.
Couldn't say it any better than that, Colonel. All right, well, we came here to deliver a message. We hope that it has been heard loud and clear, and the future of our city depends on it. And we're asking people to follow us and to also be leaders amongst themselves. Thank you. All right, thank you.
Mayor, can you explain the difference between what we had with mask mandates before and how this advisory differs?
Well, what it does is that it doesn't trigger enforcement from the city of New Orleans and agencies that have been on the forefront over the past 18 months. So it puts the responsibility on individuals themselves, and particularly who are the minority who have yet to be vaccinated in our community. And it's time for them to do the right thing for the betterment of our entire city.
And if I may, your reaction to the legislators failing to overturn the veto of the transgender.
I didn't come out with my flag for no reason, and this wasn't, this is a flag that's in my office every single day since I've been here. It's a big deal. On the front end, and thank you to the leadership at the state level who did stand against discrimination. That's number one, and will always be number one for me. And for a city that is welcoming of all people, no matter who they are and no matter who they love, but also as it relates to what we knew we could lose as a city as well. Not only not dignifying our people, but also as it relates to whether it was the NCAA and hearing directly, and also being a receiver of one of those games when another state did something that was against their values. And so I'm proud of the leadership at the state level that stood tall today that made the right decision. And I understand sometimes it's tough, to make hard decisions, but when we're talking about discrimination, shouldn't be a hard decision to make at all. So people stood for our transgender community. They stood up against discrimination, and they also stood up for the economy of our city, and at a critical moment in time. But it's about our people. They're first.
We have time for one last question. WWLTV.
Say if the city doesn't reach the progress that we're hoping for, are you considering even more restrictions?
Well,
We'll just get to that when we get there.
Well, this is where we are doing what we've always done. We've been consistent, even in how we set up not only advisories, but give our mandates. We will revisit, we look at data all the time, and we have also stated that, we have a great fall that we're all looking forward to that could be jeopardized and will be jeopardized if we do not do the right thing. So we'll revisit that at the time, when that time comes. But I hope we don't even get there, quite frankly. Hope we don't get there. So thank you.